Baby Bumps is sponsored by the Breastfeeding for a Healthy Brownsville Community Coalition.
Hello Brownsville, welcome back to another episode of Baby Booms Brownsville. My name is Luis Salazar and I am the Maternal and Child Health Program Manager for the city of Brownsville. Here in Baby Booms, we discuss important topics and issues that affect our mother, our children, and the entire family. Today with us, we have Ms. Michelle Jones. She is the City of Brownsville epidemiologist and former program manager for the Maternal and Child Health Division. Ms. Michelle, sorry we took you out from your usual routine of fighting the COVID-19 pandemic and now the monkeypox virus. But welcome back to Baby Bumps.
Thank you, Louise. I always enjoy being here with you.
Thank you, Michelle. Today we are going to talk about mental health awareness. This topic is very complex, especially due to our culture, but let's dive into our first question. What is mental health, Michelle?
Good thing. Mental health is the state of our mind, our emotions. It has physiological characteristics, our social well-being. So it really encompasses the health of who we actually are. It also helps determine how we handle stress, how we relate to others, how we're making particular choices, and it's extremely important at every stage of life. So we can have some issues that arise during childhood, adolescence, and all the way through adulthood, even up into our later years in life. So over the course of your life, you're likely to experience some kind of mental health problem, and this is where it's affecting your mood or some of your actions, the way you think about yourself, in a negative way.
Mm-hmm. Michelle, I rarely know someone who has any of these types. How common are the health-related issues?
So they're really quite common. I believe it's 1 in 5 adults experience mental health issues. I do know that when it comes to pregnant women, especially right after they deliver, it's also 1 in 5 during that postpartum phase where they will experience a postpartum depression. We have 1 in 6 young people experience a major depressive episode, and that is actually on the increase that we've noticed because of the pandemic. We had that whole isolation which really affected our youth, and then 1 in 20 Americans live with a serious mental health issue such as schizophrenia, bipolar disorder, or major depression. And in more extreme cases of mental health and depression, death may even occur. That might be one of the outcomes, because suicide is the second leading cause of death in the United States for people ages 10 to 34. And then suicide accounted for the loss of more than 48,000 Americans in 2018. And that's nearly double the amount of lives lost due to homicide.
Wow, this is extremely sad, and unfortunately we don't pay enough attention to this topic. Would we seek to improve the health of our mothers, children, and the entire family? We're going to focus a little bit more in children. Mm-hmm. Do the children experience this type of mental health issues?
Yes, they do actually, and it happens, like I said, with the pandemic, it's actually gone up quite a bit. But what ends up happening is they're often able to be clinically diagnosed. They can be a product of the interaction of biological factors, psychological and social factors. So if there's an event going on in a child's life, let's say there's a divorce, or maybe there's some substance abuse, intimate partner violence, or things like that, children, even though they might not have the words to express it, they are actually entering into some stressors that might be attributing to less than healthy mental state of mind. Half of all mental health disorders show first signs before a child turns 14, and 3/4 of mental health disorders begin before the age of 24. And unfortunately, only about half of children and adolescents with diagnosable mental health issues or problems receive the treatment that they need. And early mental health support can help a child before problems interfere with other developmental needs. And it also creates that ability, coping mechanisms, so that way they're healthier when they enter adulthood.
Wow. I'm a specialist.
I know.
but this is the main reason why we need to take this seriously and any type of strange behavior in our loved ones. But Ms. Jones, do you know what factors affect mental health?
Oh, yeah. So there could be biological factors that create a mental health instance. You also have life experiences, like we had mentioned, maybe there was trauma or abuse going either to the individual themselves or they're witnessing it among their loved ones. But there's also even everyday stresses that can happen. There could be, oftentimes we put a lot of expectations on our children throughout school to perform and to go forward. And so those stressors can actually trigger some mental health episodes. And then there could also be a family history of mental health problems. So if they're seeing a parent or a loved one or a family member, there could be that biological component, or they could also be learning unhealthy mental health coping mechanisms and developing a mental health issue just by viewing the things and the stressors and the situations around them.
Well, there are many factors that affect mental health. Can you mention some early signs or symptoms, how we can identify when a mental health problem is arising?
Mm-hmm. Yeah, so ordinarily we look at it if you're experiencing one or more of the following feelings or behaviors, and that's like eating or sleeping too much or too little, pulling away from people, their usual activities, having low or no energy, feeling numb, having unexplained aches and pains. A lot of times people don't realize that if our mental health is declining, we actually physically feel it in our body, and our body is trying to tell us that there's something going on and we need to take a step back and kind of address some of these issues. Of course, smoking, drinking, or using drugs more than usual, or even just kind of beginning to do those. If you feel helpless, hopeless, yelling and fighting with family members, persistent thoughts or memories that you can't get out of your head, hearing voices or believing things that are not true. And that's not just like a story, like a friend tells you a tall story, but like actually believing in things that don't exist, and thinking of harming yourself or others, and the inability to perform daily tasks like taking care of your children or getting to work or school. And sometimes some of these things, this is why we miss it sometimes in children, is because are they going through the terrible twos? Are they going through a phase? Have the hormones hit? Because some of these things can actually occur in tandem. And so sometimes they go or either misdiagnosed or undiagnosed.
Well, one of the most common concerns that we see in our citizens is the thinking that anyone with a mental health issue could be violent. Is this something that is true that we need to worry about?
It's actually really rare for someone who has a mental health issue to become violent out of the percentage of individuals. I mean, it does happen. We shouldn't ignore the fact that it does happen once in a while. But most of the time, it's that withdrawal from individuals. It's really an extreme disorder if they start looking at violent tendencies. But you're mostly going to see it, loss of appetite. Someone's losing a lot of weight all of a sudden, or they're having problems getting out of bed, conquering the day, things like that. And that's not a violent thing. It's just kind of like you're moving into yourself. I think only 3 to 5% of individuals or violent acts can be attributed to individuals with living with a serious mental illness, and people with severe mental illnesses are over 10 times more likely to be victims of violent crime than the general population. And that's often because they're putting themselves in situations where they're not protecting themselves because they're kind of feeling that disconnect from society and from themselves.
Mm-hmm. Wow. Michelle, our last question is there anything we can do to help individuals with mental health issues?
So most of the time people with mental health issues actually do get better and can recover completely. So let's just put that on the table. This isn't like if you get told that you have an issue or you're experiencing some of these, it's not like there's not any hope. We can get better. One of the things I always do is listen to the individuals. Recovery refers to the process in which people can live, work, learn, and participate fully in their communities. And that's our end goal when we see that. There's psychologists, There's psychologists and psychiatrists. You've got your school counselors. There's also support groups for individuals that are experiencing these. So there's a huge amount of resources, not only pharmaceutical, but also communal, that can help us through this and just get us to be a really healthy, functioning individual. And when we do that, we make it better for the next kind of crisis that might arise for them, that they have the tools, they know how to handle it, and they've done it before. So we're empowering them when we do this.
Great, great. Michelle, we really appreciated you came here to clarify your questions. Is there anything else you would like to share with us?
Yeah, I would just say always remember everybody's on their own little journey, and just to be kind. A lot of times we like to judge people, but if we're kind with individuals, we're giving them that safe space in which they can operate, and that safe space is where real healing begins, and where we actually improve the livelihood or the mental health of that individual.
Great. Lastly, I would like to mention that there is a new lifeline that is now active across the United States. You can always call 988 to have access to this lifeline. This new and shorter phone number will make it easier for people to remember and access mental health crisis services. Once again, thank you, Michelle. I really appreciate you came with us. I would like everyone to know that Baby Booms is sponsored by the Breastfeeding for a Healthier Brownsville Community Coalition here in Brownsville, Texas. Remember to subscribe to our City of Brownsville YouTube channel and to join our BTX Maternal and Child Health. And remember, an informed parent is an empowered parent. Thank you so much, and see you in our next Baby Booms episode.
Bye.